This video is provided for educational purposes only and is not intended to replace discussions with your healthcare provider. The product information provided in this video is intended only for residents of the U.S. In your brain, there are chemicals that occur naturally to help control movement. One chemical is dopamine. Dopamine works like pressing the gas pedal in a car to help your body move. Adenosine is a different brain chemical that works like pressing the brake pedal to limit movement. Normally, adenosine and dopamine work together in balance to help you move the way you want to. However, in Parkinson's disease, there is too little dopamine activity and too much adenosine activity. It's like letting off the gas pedal while pressing on the brake pedal. This imbalance can cause Parkinson's symptoms such as difficulty in moving. Many treatments for Parkinson's disease, including levodopa-carbidopa, focus on increasing dopamine activity. But over time, levodopa-carbidopa can start to wear off and stop working well, and Parkinson's disease symptoms can return. When this happens, people may experience off time. NOURIANZ, istradefylline, is a prescription medicine used with levodopa and carbidopa to treat adults with Parkinson's disease who are having off episodes. It is not known if NOURIANZ is safe and effective in children. It works differently from other add-on medicines for off time. NOURIANZ is the first and only treatment that lifts the brake of adenosine for off time in Parkinson's disease. Although it is unknown how exactly NOURIANZ works, it is believed that decreasing adenosine activity is like lifting the brake in a car. This helps to increase movement for people experiencing off time. If you are currently taking levodopa-carbidopa and are experiencing off time, it may be time to talk to your doctor about lifting the brake of adenosine by adding NOURIANZ. Please continue watching for the full NOURIANZ important safety information and see accompanying full prescribing information. Important safety information. Before you take NOURIANZ, tell your healthcare provider about all your medical conditions, including if you have a history of abnormal movement, dyskinesia, have a history of psychotic thinking or behavior, have reduced liver function, smoke cigarettes or use other tobacco products, are pregnant or plan to become pregnant. NOURIANZ may harm your unborn baby. Are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. NOURIANZ and other medicines may affect each other, causing side effects. NOURIANZ may affect the way other medicines work, and other medicines may affect how NOURIANZ works. What are the possible side effects of NOURIANZ? NOURIANZ may cause serious side effects, including uncontrolled sudden movements, dyskinesia. Uncontrolled sudden movements is one of the most common side effects. Hallucinations and other symptoms of psychosis. NOURIANZ can cause abnormal thinking and behavior, including being overly suspicious or feeling people want to harm you, paranoid ideation, believing things that are not real, delusions, seeing or hearing things that are not real, hallucinations, confusion, increased activity or talking, mania, disorientation, aggressive behavior, agitation, delirium, decreased awareness of things around you, unusual urges, impulse control or compulsive behaviors. Some people taking NOURIANZ get urges to behave in a way unusual for them. Examples of this are unusual urges to gamble, increased sexual urges, strong urges to spend money, binge eating, and the inability to control these urges. If you notice or your family notices that you are developing any new or unusual symptoms or behaviors, talk to your healthcare provider. The most common side effects of NOURIANZ include uncontrolled movements, dyskinesia, dizziness, constipation, nausea, hallucinations, and problems sleeping, insomnia. These are not all the possible side effects of NOURIANZ. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see patient information for NOURIANZ.